Okay, I think we should probably get started. Good afternoon. My name is Al Tillery, and I'm the director of the Center for the Study of Diversity and Democracy here at Northwestern. And I'm thrilled to have you all in attendance for the second in our wonderful lecture series co-sponsored with the Changemakers Committee of Northwestern. The lecture series is Anti-Racism in Thought and Action. And today's panel discussion, the title is The Dual Pandemic, Racial Inequalities, Racism, and COVID-19. I want to thank my collaborators, Stephanie Hicks and Stephen Adams, for inviting me and the CSDD to partner in this wonderful enterprise. And I want to thank the Department of Human Resources for providing the financial support to sponsor the series. It's our great pleasure to welcome 4 of the nation's leading scholars of racial and ethnic disparities related to politics and healthcare to share their wisdom with us on this panel. Now, as I said on last time, I could easily spend the entire hour just doing the introductions of these esteemed guests. But because we're in a power hour, we're going to go with the short form. I need you all to forgive me. I'm going to give just the kind of title and location of these wonderful scholars, so you'll be able to reach out to them and find their works on their websites, etc. So first, we have Northwestern's own Dr. Melissa Simon. She's the director of the Center for Health Equity Transformation and the George H. Gardner Professor of Clinical Gynecology at the Northwestern University Medical School. Her primary research interests are focused on promoting health equity and eliminating health disparities among low-income, medically underserved women across the lifespan. Next, we have Dr. Manish Arora is an assistant professor of political science at Wellesley College. His research focuses on health interventions, politics, and public opinion, with a particular focus on sort of social movements and communication. We also have Dr. Kim Yi Dion, who's an associate professor of political science at the University of California, Riverside. Her research agenda centers on health interventions, politics, and public opinion, and she centers that work primarily on the African continent, but she does a lot more than that as well. And we also have Felicity Turkman, who is a PhD candidate in political science at the University of California, Riverside, where she focuses on comparative government, migration, and refugee politics. So thanks to you all for joining us. We're going to do the presentations in the order in which I did the introductions. So Melissa, Manish, and then Kim and Felicity are going to share their time. And so I'll turn it over to the panelists. At the end of the panelists having their sort of conversation with us, I'm going to turn it over to Stephanie and Steve to moderate the Q&A. And then we're going to close out. Steve's going to give us all some homework, which is going to be really cool at the end. So Melissa, I'll let you go ahead and start us off.
Thank you so much. Thank you all for joining us today. All right, so beyond just 2 pandemics, there's actually a few more, and you could add to this list, I'm sure, but distrust and misinformation are super prevalent on both sides of the aisle across the country. And those really do intersect with racism and COVID-19. So the framework that we use when we're talking about health equity and equity in general is this, in the upper left-hand corner in inequality, you see the tree is bent, right? Some population or persons are being advantaged to the person on the left of your screen towards which the tree is bending, versus some populations or people are being disadvantaged, the person on the right as the example. And equal, when we say everything should be equal, that would assume that everybody gets the same lift to try to reach an apple on that tree. And again, those certain populations still get advantaged than other populations and people, especially here with the tree bending towards one side and the ladder being not high enough on the right side of the tree. In an equity framework, we acknowledge, and this is true for healthcare delivery, we need to acknowledge that everybody needs a different kind of lift different supports, if you may, and modified structures to allow for everybody to have a chance to get that apple or the goal that they're trying to achieve. And in our case, in healthcare, equitable health and healthcare. In a justice framework, though, really getting to where we need to go with healthcare delivery and equity, et cetera, is really seeking to have people who see that the tree is bent and then seek to unbend the tree. And I say unbend and not straighten because it may not be straight. That's the solution, at least temporarily or in the near term. So it's really important that we aim for justice and we ask the critical questions of why is the tree bent in the first place and how do we unbend that tree? So we know that racism is deeply embedded in everything, especially systemic racism, and racism is a fundamental cause of disease. It kills, and even to this day in recent reports, people don't acknowledge that racism plays a role in health, and it absolutely does. Here is a very typical picture of the social determinants of health. You've got around that circle, social environment, public health, public safety, transportation, education, employment, health systems and services, housing, income, wealth, resilience, all of those things impact health. And indeed, only about 10% to 15% of biological factors impact health. Another 20% or so is due to health behaviors, but everything else, including health behaviors, are driven by all of these other supports and what kind of neighborhood you live in, et cetera. And systemic racism that you see in the red on the left-hand side of that circle really impacts everything that is created, policies, segregation. I mean, our city in Chicago is a very great example of highly segregated city that has been built on decades of disinvestment from the south and west sides of Chicago. And you thus see that the map of where the disease burden is, especially right now in COVID, are in those south and west side communities, in the Black, which are predominantly Black and Latinx. Discrimination affects health. This is from Dr. David Williams at Harvard. And this is really the house that racism built, cultural racism, institutional racism, segregation, individual discrimination, all impact to the right in that top part of the house. All of the social and economic, political, and structural factors that I mentioned in the previous slide. If you look down on the bottom part of that house, the basement, if I may, you see that the experience of racism and that weathering hypothesis really does impact psychological responses, biological processes, behavioral responses, healthcare use responses, individual and collective responses, and that impacts health outcomes and health in general. So the way I see it is that there's two cliffs, and why is the cliff where the green people are in that picture, why are they close to the edge of the cliff, and why are there no supports for a fence or a safety net if they fall through the fence, or an ambulance that works, has GPS functions, gas in the tank, and tires that aren't popped? Again, systemic racism plays a huge role in driving these separate cliffs. So racism exposes Black, Latinx, and Indigenous people to COVID more, and it protects them less than their white counterparts. We, and me being Latina, I'm going to refer to us as we, make up more frontline worker positions, and we have greater residential and educational segregation. It's much harder to physically distance with or isolate with multi-generational households. We have poor access to information and education, and in other languages, many of the COVID resources were developed first in English. And they all developed first in English in our country, and some of them were translated into Spanish, and it was poor. The first few drafts were poorly translated. There's greater proportion of our populations unhoused, doubled up in prisons, jails, immigration detention centers. Then once infected, our people are more likely to die because we carry a greater burden of chronic disease, especially diabetes being a very relevant one. Poorer resources from disinvested communities, the food, access to housing, job security or insecurity, environmental toxin exposures, et cetera. And we have less access to healthcare, less access to COVID testing. And that was true across, just looking across the city and the surrounding suburbs, there was definitely less access to COVID testing, and contact tracing was not optimal. And it remains that way. Workforce protection violations, especially in Illinois, were large, and especially in the factories, meat processing plants. This really promulgated a lot of COVID in our communities. And then if you add the intersectionality of being female, pregnant, having children, living in poverty, it really augmented the oppression and the compounded racism effects. And it drove even more. You see it play out with the COVID-19, making that bad situation even worse, and exacerbating all these social economic determinants of health and political determinants of health. If you look very briefly in the red circle, the pregnancy and COVID-19 from the CDC, Centers for Disease Control and Prevention data, again, COVID-19 hit Latinx and Black women disproportionately compared to white women. Same with children, hit Latinx and Black children even more. And in both cases, with pregnant persons, Black and brown pregnant persons and Black and brown children, they had the highest cases of those that would be hospitalized if you had COVID, be hospitalized, and then intubation, and poor outcomes. A little more food for thought before I finish is that unemployment rates were higher than at any point since the Great Depression. Latinx women's unemployment rates were as high as 20% almost, Black women 17%, white women 11.9%. Those who remained employed are more likely to be frontline workers and more exposed and have less protections for COVID-19. And in December of 2020, 140,000 jobs were lost on the job per the job report, and all of those 140,000 were reported to be held by women. That is egregious. There also was reduced use and reduced access to pre and postnatal care. So I'm an obstetrician, so I really focus on this part of the of health. We pivoted overnight across healthcare delivery to telemedicine visits, so either by phone or by video. And this created a huge digital divide, just like school by Zoom or other platforms created a digital divide. This did too. Definitely less feasible in rural areas and tribal lands. And then when the internet access is sketchy or inconsistent, as often in low-income communities, this was a big problem and continues to be. Also, patients with physical or cognitive disabilities may also have faced many challenges, but again, not well documented yet. Things like visitation policies in hospitals and with clinics profoundly impacted laboring women and the labor floor. Only having one visitor or no visitors if they had if they were COVID positive was a big issue with respect to the maternal mortality and the Black-white disparities that there are in maternal outcomes in our country currently. And this was a big issue. Also, there were things like lack of access to birth control options if you didn't have insurance, and trying to get access to them during COVID has been a big issue. Food insecurity, intimate partner violence has risen. We believe that child mistreatment has also risen. Depression, anxiety, suicide, and substance use have all increased as well. So strategies to address are at every level. In the middle of that circle, the interpersonal barriers, support like patient navigators, community health workers. You've heard a lot about that with respect to COVID response. In the next circle, quality improvement, really trying to, at the clinic level and at the hospital level, to employ safety bundles to ensure that there's a consistent quality of care delivered regardless of where you seek care. Critical race theory training and implicit bias training, although I don't believe that implicit bias training is a panacea. It is something that some hospitals and state laws have enacted. And advocacy and policy in Chicago and at the Illinois levels, there have been racial equity rapid response teams specific to Illinois and things like the Latinx population across multiple sectors. We got together and created Illinois Unidos, and that has been a really helpful response. So to conclude, racial and ethnic inequities just don't happen. We must make good trouble and seek to look under the hood of the car and really look at that tree and see where it's bent, and seek to unbend that tree. And there really is a clear line between racism and the impact on health. Thank you. I'm going to stop sharing my screen.
Wow, that was fantastic, Melissa. And I caught that sly reference to Mr. John Lewis there at the end. Wonderful. So we're going to transition over to Manish now.
All right, thank you so much to the organizers, and thank you to Dr. Simon for really fascinating remarks. I also love the tree analogy. I'm going to try to find that image for my classes. So I'm going to take us in a little bit of a different direction and focus my remarks on two things. So first, talking about the anti-Asian rhetoric that we saw from Trump and his allies, and the effect that has had on attitudes and behaviors among the public, and then talk a little bit about the ways that political elites and members of the public have responded to and at least tried to combat some of that rhetoric. So on March 16th, Trump used the term Chinese virus for the first time on Twitter. And since then, we've seen just an explosion of hostile and discriminatory rhetoric from Trump himself, from White House officials, from members of Congress, mostly Republican members of Congress, Fox News hosts, and other media and political elites. Some, like Texas Senator John Cornyn, use specifically racist stereotypes like Chinese people eating bats or dogs as a reason to justify the blame on Chinese people for the virus and the spread of the pandemic. Arkansas Senator Tom Cotton suggested that the virus had been developed in a Chinese lab without showing any evidence for that claim. Others made references to lack of cleanliness, to hygiene, other racist tropes that we've seen throughout history against Asian Americans. And these are just a few of the many examples of elite rhetoric that has tied the virus and the subsequent pandemic to the Chinese people. And this is important because there's such a rich history of scholarship that shows how powerful elite messaging is in shaping attitudes and behaviors among the public. Research from Brian Schaffner, and I think just given what we've seen over the last 4 years, has also made it clear that Trump's rhetoric is particularly powerful in shaping public attitudes and activating prejudice and discrimination from his followers. And that's one of the reasons why we would expect this kind of rhetoric to have had some pretty powerful effects on attitudes and behaviors, and that appears to be what we find. So some of the early research on this kind of anti-Asian elite rhetoric has found that it's both heightened and activated anti-Asian sentiment from the public. So there's this great data coming out of UCLA that's found a stable decrease in favorability ratings of Asian Americans, which is particularly notable because Asian Americans have tended to have relatively high and fairly stable favorability ratings among the American public, and really regardless of party, regardless of race, they're pretty rated relatively highly. And we've seen a pretty significant and consistent decrease in that since March of 2020. Another paper shows that these low favorability ratings of both Asian Americans in general and Chinese Americans in particular are correlated with worries about the pandemic. And in turn, being worried about the pandemic and having these low favorability ratings is predictive of reported behaviors such as saying that people will stay away from foreigners, quote unquote foreigners, right? Or that, they prefer other cuisines like French, Moroccan, Italian to Chinese restaurants. And even predictive of policy attitudes, such as wanting to decrease the number of visas given to people from countries in Asia, and even to having mandatory quarantine of all Asian American people in the United States. So we're seeing not just this heightening of anti-Asian sentiment, but seeing that it's tied to particular worries, concerns, and policy positions related to immigration and the COVID-19 pandemic. And in addition to survey data, there's really clear evidence of the effects of this kind of rhetoric on the rise in hate crimes. So full hate crime data for 2020 hasn't been released in any systematic fashion yet, but reports from Asian American advocacy groups, from sites such as Stand Against Hatred, Stop AAPI Hate, and the AAPI COVID-19 project have indicated a substantial surge in anti-Asian discrimination and hate crimes throughout 2020. Asian Americans reported being yelled at, coughed on, spit on, physically assaulted, refused service, or otherwise discriminated against. There were reports of people staying away from Chinatowns and avoiding Chinese and other Asian cuisine restaurants. In many of these incidences and hate crimes, there was explicit references made to some of these terms that were used by Trump and his allies, Kung flu, Chinese virus, Wuhan virus. And so seeing kind of a clear connection between that kind of rhetoric and these hate crimes and discriminatory behaviors. Many of the verbal attacks also included anti-Asian slurs and made references to racist stereotypes that have been used for years. In one of the most horrific attacks in a parking lot in Texas, 3 members of a family from Myanmar were stabbed, including a 2-year-old and a 6-year-old. In another example that occurred in April, an Asian American woman who was taking out her trash outside of her home in Brooklyn was thrown acid at and got burns all over her arms, hands, and face. And, you know, in addition to these very clear detrimental effects on the victims of these hate crimes, there's also larger mental health and psychological effects for the community, even among those who have not been personally affected by these hate crimes. You know, research from public health is also already showing poorer mental health among Asian Americans, including heightened fear and anxiety, again, even among people who haven't been personally affected by hate crimes that we've seen. So it certainly seems that people were emboldened by rhetoric from Trump and his allies. So while anti-Asian hate crimes, of course, are not new, it does seem like the pandemic, and coupled with this kind of rhetoric that we're seeing that explicitly blames Chinese people for the virus, has increased the magnitude, the spread, and really the viciousness of these anti-Asian attacks. So all of this, I think, shows a clear and detrimental effect of this rhetoric on the public. And, you know, I think as we'll hear from the next panelist, also, of course, nothing new, and something that has been tied to pretty much every public health pandemic that we've seen in the past, with this tendency to blame immigrants, to blame quote unquote foreigners, and this activation of xenophobic attitudes. So I also want to spend a little bit of time just talking about how people have responded to this kind of elite rhetoric, and things that, you know, people like you or I can do to also try to combat that rhetoric. So in a paper that was published in October that I worked on with my co-author Hannah Kim, we looked at Twitter data from every member of Congress throughout 2020. And we wanted to look at what are members of Congress saying to condemn and to combat the anti-Asian rhetoric that we've been seeing. And as we expected, we found some pretty strong effects by race, by gender, and by party. So Asian American women and women of color in general were the first to condemn this kind of rhetoric, were the most likely to and most consistent in their condemnation. They were the first to point out the harmful effects, and they continued to do so throughout 2020. We also found some pretty strong effects by party, with Democrats, of course, being much more likely to be condemning this kind of rhetorical attacks, And as the rhetoric started to shift, we also found that these same communities were most likely to condemn any kind of discriminatory attacks, whether against Latinx, Black, Native American, or other minority populations. And this was pretty consistent in our data throughout 2020. And this is important also because, other papers people have worked on looking at legislation have found that Asian Americans, and particularly Asian American women in Congress, were the most likely to be introducing anti-discrimination legislation. So we saw that this rhetoric on Twitter was also translating into policy responsiveness, or at least indications through policy that it was important to condemn this kind of rhetoric. And finally, I want to talk about a study I recently came across where there's some scholars who have collected a data set called COVID hate, which at the time of the study, they'd collected over 30 million tweets that related to anti-Asian hate, but also counter hate messages. And this was not just, related to members of Congress, but this was, anyone on Twitter. And what they found first is that there's widespread anti-Asian discriminatory comments on Twitter, many of which, again, echoed a lot of the comments that we heard from Trump, from White House officials, from other political elites. And that those messages actually enabled other people to then express hate, and there was a domino effect. And so it showed the really harmful effects of this rhetoric and how it can spread so easily through social media. But what they also found is that counter hate messages were effective in both decreasing the expression of hate and stopping those who had been exposed to those counter hate messages from expressing hateful comments or prejudicial comments in the first place. And so I think that shows something that, most of us who are on social media or communicating with members of our community and in other ways can do, that, just expressing these counter hate messages and showing the harmful effects of this hateful rhetoric can effectively stop the expression of that hate in the first place. And so, some, I guess, somewhat hopeful results, that I can end my comments on. So thank you so much for your time, and I look forward to any comments and questions at the end.
Thanks, Manish. That was so powerful. Okay, so we'll turn it over to Kim and Felicity for their presentation.
First of all, thank you, Professor Altillery, for reminding us and for all the folks at Northwestern who made this event happen. And as previous presentations already highlighted, as COVID-19 began to spread around the world, so that reports of discrimination and violence against people from marginalized groups also emerged. And in our paper, The Politics of Pandemic Othering, Putting COVID-19 in Global and Historical Context, we argue that in a global politics characterized by racialized inequality, pandemics such as COVID-19 exacerbate the marginalization of already oppressed groups. So in our article, we review published research on previous pandemics to historicize pandemic othering and blame, and enumerate some of the consequences for politics, policy, and public health. And specifically, we draw on lessons from smallpox outbreaks, the third bubonic plague, the Spanish flu, and more recent pandemics such as HIV/AIDS, SARS, and Ebola. And for today's presentation, I'll share what we learned from the third bubonic plague. Then Kim will share information from our paper that documented the discrimination and violence targeting marginalized groups early in the COVID-19 pandemic. And we will also discuss the political and public health consequences of pandemic othering. We hope in hearing this presentation or in reading our paper, you walk away with the understanding that putting COVID-19 in historical context lays bare the continuation of a long history of othering and blame during disease outbreaks and identifies needs for further inquiry to understand the persistence of these pandemic politics. So during the third bubonic plague, which lasted from 1894 to 1950, societies around the world linked the pandemic with discourses on race, immigration, and class. And states instituted racialized plague control measures. White South Africans linked the plague to race and immigration, as did elites in Buenos Aires and Rio de Janeiro. And in all these cases, scientific authorities had also instrumentalized the disease outbreak to promote social engineering that pushed unwanted groups to the margins of urban settings. In the colonial French Pacific, the outbreak brought to the surface racial and class tensions between white settlers and the majority population in New Caledonia. In the United States, the Chinese and Japanese also experienced discrimination. For example, while all travelers were subject to inspection upon arrival in San Francisco's port, only Chinese and Japanese travelers were subject to detention. And there are also reports of incidents in which Americans in China were targeted and accused of importing the plague. Violence against foreigners during the pandemic was sufficiently bad that the American consul in Canton wired his concerns about the safety of American citizens there. So.
And you know, as our colleague Dr. Aurora has already talked about, you know, I think perhaps most famous in the COVID-19 outbreak is former US President Donald Trump and his administration regularly engaging in rhetoric that placed blame on China for the pandemic. And so much of the intention in the US has been on anti-Chinese and anti-Asian rhetoric, discrimination and violence here in the US, right? Asian Americans being refused services and being targets of racist violence. We also collected information from Stop AAPI Hate, which Dr. Aurora had mentioned. And the kinds of incidents that they documented ranged. Verbal harassment, shunning, which those two make up the majority of self-reports, but again, there were also these physical assaults. That wasn't limited to the US though. In France, Asians have been the targets of racist incidents on public transport, in shops, at schools, even just walking down the street. Asians in France face discrimination, racial slurs, and isolation, and many documented these racist encounters using the hashtag Je ne suis pas un virus, right? I am not a virus, translated into English, which trended on Twitter. In Italy, in early February 2020, when there were as yet only 2 confirmed cases of COVID-19, Chinese nationals and tourists faced xenophobia. Chinese-owned businesses were empty. Chinese individuals were banned from businesses and gatherings. In the United Kingdom, where a Singaporean exchange student was badly beaten by assailants invoking the COVID-19 outbreak, a hate crime awareness group reported receiving an increase in calls from people experiencing racism, discrimination, and verbal abuse arising from these perceptions in the public that they're members of the Chinese community and therefore likely to be carriers of the coronavirus. Now, Chinese also face discrimination in Asia, right, with multiple documented incidents of racial profiling and discrimination against Chinese in Japan, Singapore, South Korea, Thailand, and Vietnam. In South Korea, for example, some businesses posted signs saying no Chinese, and more than 500,000 Koreans signed a petition calling on their president to ban Chinese visitors. Now, even in China, right, the place where, you know, the first documented case of this this novel coronavirus emerged, you know, there were multiple incidents of increased discrimination of Africans after the media reported that 5 Nigerians had tested positive for COVID-19 in Guangzhou, which is a city in southern China with a sizable population of African migrants. Africans in Guangzhou reported being evicted from their apartments and being refused entry at restaurants. You could see videos on WhatsApp of people being refused entry into supermarkets. There were hateful online messages and multiple violent attacks of Muslims across India after government officials blamed an Islamic seminary for spreading COVID-19. And during a state-imposed coronavirus lockdown in May, Hindu attackers burned Muslim homes and shops and vandalized a mosque and a Muslim shrine over 3 days of violence and terror in West Bengal. And these and then retaliatory incidents followed news that 5 Muslims in the area had tested positive for the coronavirus. Finally, we also document in our paper during this pandemic, migrants in multiple regions reporting increased racism and xenophobia during the COVID-19 pandemic. We used reports from the Mixed Migration Center, which has been studying how the pandemic has affected migrants in Asia, Latin America, and Africa. And in surveys conducted with over 3,000 respondents, 20% reported increasing racism in the wake of the virus. Now, beyond the normative concerns of othering during pandemics, which on their own are sufficient for rejecting the practice, othering has important consequences for politics, policy, and most importantly, for public health. Now, the primary socio-political consequence is the exacerbation of existing tensions and inequalities between and within groups. Migrants and people from other marginalized groups reported experiences of discrimination across the pandemics that we examine, not just COVID-19, but all of these pandemics in history as well. And the current COVID-19 crisis has shown that a disease threat associated with a group can activate already existing xenophobic attitudes towards that group. And we get this from a paper that I think Dr. Aurora was referencing. This is Tyler Rennie and Matt Barreto's paper, two colleagues out of UCLA. Now, there are also policy consequences. We have policies on border restrictions and quarantines commonly enacted during pandemics. And pandemic othering shapes these policies, as shown in a review of the quarantines in the United States over the past 200 years that found evidence of a quarantine logic used as a medical rationale to isolate and stigmatize specific social groups that were reviled for other reasons. And these quarantine policies leave a legacy that outlasts their epidemiological usefulness. You know, we have an example of at the Texas-Mexico border, right, where, you know, there was a typhus outbreak, you know, and 40 years later, you still have discriminatory screening of Mexican migrants coming across the border. Now, pandemic othering and blame can also have consequences for policy related to responding to the pandemic. So what that means is, you know, we see policy inaction. Middle income countries like India and South Africa, political elites delayed response to AIDS, a serious pandemic that continues to affect millions of people around the world. And the reason why these elites in South Africa and India delayed response was because they understood the AIDS pandemic as aligning with boundaries between certain identity groups. And, you know, so the real important outcome that we think matters, you know, perhaps the most is that the implications of othering and blame during a pandemic are its public health consequences. When people associate a disease with a marginalized group, people will try to avoid being marginalized and stigmatized. So you might, if you're a member of that marginalized group, you might deny that you have early symptoms. You might delay seeking care. Early in the COVID-19 pandemic, we saw that Asian Americans debated whether to wear masks because doing so could draw unwanted attention and potentially provoke physical attacks. And researchers found that attribution of AIDS to foreigners and to complacency led to complacency and denial, and worried that such denial could further a silent spread of HIV infection. And we're seeing that in the COVID-19 pandemic. Gabe Sanchez and Edward Vargas wrote in the Washington Post about how, you know, white Americans were less frequently adopting protective behaviors compared to Americans from marginalized groups, particularly with related to face coverings. Now, in this article, which is available online and free to download in the current moment, I think there's another maybe 30 days where you can freely download the article. You know, we argue that pandemics further marginalize already marginalized groups, and we try to use these historical and contemporary experiences to highlight how concern that a pandemic will spread to or greatly affect centers of power in the West can impose demands upon states that activate racial discipline in states' respective pandemic responses. And while the current pandemic is the result of the emergence of a novel coronavirus, the discriminatory responses to COVID-19 show that it's merely a contemporary example in a long history of othering and blame during pandemics. And the consequences are also not unique. historical perspective reminds us that even major catastrophes like a pandemic are only part of an ongoing global and historical process. And I just want to come back to something that Dr. Simon said earlier, that COVID-19 has made a bad situation even worse. It's so true in this case. So many people want to focus on US President Donald Trump, but long before he was calling this China virus a Kung flu, we've seen leaders do this in the past. So while COVID-19 has deeply changed our everyday life in the contemporary moment, our paper would encourage all of us to put the pandemic in a broader historical perspective, especially when considering the ways that pandemics and disease can be racialized and politicized.
Wow, that's fantastic. Thank you so much. So I'm going to turn it over to my colleagues, Steve and Stephanie, to run the Q&A.
Hello, good afternoon, everyone. I'm actually looking at the Q&A and I don't see any questions yet. But what I did want to ask of our panelists is, with all the information that you provided for us today, what are some of the things that individuals can do to promote more inclusivity, understanding that there are these attacks kind of coming from every direction?
I can start. I think, as I mentioned in my remarks, one of the main things I think, at least on an individual level, is just putting that message out to at least the people in your community and the people that you communicate with, of, it is harmful to blame any certain group of people for something like this kind of public health pandemic, and that worsens health outcomes for everybody when that happens, right? So, not just for that group that's being blamed, but like, Professor Dion said, and soon to be Dr. Turkman said, that this can lead to slower policy responsiveness when that happens. And what we have found is that these kinds of messages can be effective in changing attitudes, or at least stopping the expression of hateful or discriminatory rhetoric. And so that's one small thing that we can all be doing to contribute.
Anyone else?
Yeah, I'll jump in with one while we're waiting for the audience to warm up. So, where Melissa ended and where I think Kim, Felicity, and Manish ended, they're all kind of pushing in the same direction. And what's been so interesting for me to watch is, and Melissa, I've got to have that visual too that Manish asked for. That was amazing, the apple tree visual. But this kind of notion that people are coming to the solutions phase around COVID-19 with different conceptions of racial equity, right? And so we see that a lot this week in Chicago with schooling, right? So you've got, white parents and, the more affluent areas of the city saying, the kids have got to get in, right? And then you've got the Black and brown, Black, Latinx, Asian, parents, regardless of income level, saying, wait a minute, like, we're not exactly ready for everyone to be in, right? And so how do you, but then the white parents are saying, well, equity is everybody being in, not, like at Evanston, our superintendent said, well, equity should be putting the parents, the kids of the essential workers in first, and they're mostly Black and brown, right? And then people are saying, well, that's not fair. How do we navigate these conversations around equity, fairness, and race to get to good solutions? That's for everyone. So.
What a great question, Al. Thank you for posing it.
I think it's a tough nut to crack. I mean, that's really where we're going to move forward, if we can really speak to that intersectionality and see it across all racial ethnic groups, across all socioeconomic positions, across the highest levels of leaders who are demonstrating this and leading with that message that we're all humans at the end of the day, and we're all in this together. And the only way to end this pandemic is to do it together. Vaccination is a perfect example right now of what's going on. And, the disconnect between starting school, like February 1st, Chicago Public Schools will be going back K-8, but starting school, but not vaccinating the teachers and the school staff first. I mean, if there's a disconnect there when, yes, it's hard because there's lots of schools and lots of staff. I got that. But it could have been, done. It can still be done, but not by February 1st at this point because of our vaccines and needing, 4 weeks or 3 weeks apart, depending on which one is administered. So things like that, we need to be better with connecting our policies and our practices with what's the on the ground reality and who this impacts, and then understanding the togetherness and the connectedness that we are all connected.
I agree that this is a really difficult, and this is a really political question. Like, how do we get around this? And I do think that, if we can't leave it to individual behaviors, right? Like I'm seeing it, for example, unless we can get, people of privilege to stop hoarding their privilege, right? And stop, using their advantages to get the vaccines when they shouldn't be getting them, right? They aren't in need of them in the same way. And I think, relying on individuals to change those behaviors, I think is going to be very hard, especially in a situation of scarcity, right? Because that's what the research tells us, right? In situations of scarcity, people are not their best selves. And they're not thinking about collective. And I think this is a cultural issue that's particular to the U.S., right? This focus on individuality and not on the collective, I think is going to make it very difficult. And the way vaccines work, at the individual levels, you've got to have one, but collectively they work, the more people who are at the most risk getting them. And one of the things I hope as a researcher is by showing people when we're racist jerks, it's actually bad for our health, right? So if you are going to hoard your privilege and you're going to be racist and call it the Kung flu, that's actually going to make you sicker. So if your whiteness is worth your illness, then I guess keep going. But I think getting past that, getting people to stop hoarding their privilege and actually collectively acting. I mean, we are seeing white allies doing that, right? Trying to say, hey, it's not your turn. Don't get the vaccine yet. It's not your turn. There's not enough. And trying to pressure, but who do politicians listen to? And that I think is part of the problem.
Very timely, Kim. One of the Wall Street Journal headlines today was Hollywood hoarding COVID-19 vaccine. So you're absolutely right. Let's go to the Q&A. So I have a first question from Manuel, and it reads, thank you for such an engaging presentation. My question is whether in prior pandemics, did we see similar denialism about the pandemic, or whether that is a unique phenomenon of COVID-19? Is COVID denial also racially distributed?
So I think Dr. Aurora might know more about beliefs about COVID denial and its racial distribution. I am certain there are scholars who are working on this. I have not done research on this specific question in this specific pandemic, but I can say that denialism about previous pandemics, again, that has happened throughout history, including, for example, HIV/AIDS. And in fact, we saw here in the United States a racialized denialism and racialized boundaries about understanding whether, where HIV/AIDS comes from, and who is most at risk. So I think that, again, back again to that comment, right? COVID-19 has made a bad situation even worse. The existing underlying racialized context, the racism and the systemic racism is getting activated by the pandemic. The pandemic isn't making us racist. We were already racist, and this is just activating that.
Yeah, just to add on to the belief aspect of this, there's some great work Sarah Goodman and colleagues are doing right now on COVID denialism, and it's certainly politicized. So we're seeing that Republicans are much more likely to believe these conspiracy theories about it being a hoax, or that It's not as dire as it seems, and also less likely to be, and I think this was mentioned in other presentations, less likely to be wearing masks or participating in social distancing or doing other behaviors that would help stop the spread. And so certainly in that sense, it's also racialized, given that our party system is racialized. And this is not surprising given where we see the denialism coming from, right? If it's coming from Donald Trump and other Republicans, it's not a surprise that then that denialism takes root among the Republican public.
Okay. So that's great. We should probably shift gears here and have Steve come in and give his homework assignment, and then we might have time for one additional question out of the queue, depending on how this segment goes. But Steve, I'll turn it over to you.
Thanks a lot. Thanks everyone for your wonderful presentations. And just like last month, we have some homework for all of you. I'm going to share this slide. Okay, you should see the slide there. So those of you who are familiar with the Changemakers program know that it is focused on both self-work and community work. Those of you who are Changemakers alums, we miss all of you. And those of you who haven't heard of the program, we may be seeing some good stuff coming in the fall, and we'll announce that at future events. Doing transformative work related to the issues our panelists highlighted today is essential. And we have the power to do that through reflecting on how we and those around us are affected by the pandemic. We can look for ways to be catalysts for change at work and in our communities. All right, so for this month's Thought in Action, take a moment to reflect on who in your community is doing the hard work of solving COVID-19 related issues, especially those folks who are not getting a lot of credit for it. One thing that comes to mind, and I will acknowledge that I have been on the board of this organization, so I hope that's not inappropriate, but for instance, the Infant Welfare Society of Evanston runs a child care center called Baby Toddler Nursery. They run a couple of different ones, taking care of the children of first responders. And they could definitely use the financial help. Again, I'll be transparent. I'm on the board of the organization, but that's one that I know about. So if you know about one, promote it, share it with others, encourage others to give what they can, whether it's $1 or 100. Also, reflect on what state and local agencies should be doing more to solve COVID issues you see manifesting in your community, and use what you learned with last month's work. If you were here at the last event, we asked everyone to find out who their local, state, and federal representatives are, from city council on up through the Senate, and write them and let them know what you're observing. They should know what you're observing. We have to make this we the people thing real. And the last thing is to reflect on what should be happening in your unit at Northwestern. Start a conversation about that with those in charge, whether it's your department chair, the person to whom you report. Talk to someone, start a conversation about what you're seeing. Maybe we're having people come back to work too early. Maybe we're seeing something related to the talk today happening right here at Northwestern. And if so, that would be a shame. Let's take some action and try to solve those issues. And the last thing I'll share is what's happening next. Our next event is on February 23rd at noon. Natasha Trethway, professor of creative writing here at Northwestern, will be giving a talk about her memoir, her current memoir. It's been a New York Times bestseller list, bestseller for the past few months, and she'll be giving a talk about race and writing. She'll also be reading a bit from the memoir, and maybe might even share some poetry. As some of you may know, she was Poet Laureate of the United States for 2 terms during Obama's administration. And she's also, a friend, and she agreed to do this. So we will thank her profusely on that day. I will share in the chat now the link for registering for that. So those of you who were loyal and came back to this call despite our technical glitches will be able to register right away. I'll share that in the chat. And we will, of course, be promoting the event through the same venues we promoted it through before. So sorry for the technical issues. Thank you for persevering. I guess we'll send this recording out. And hello to those of you who weren't able to come back right away, but are able to see this recording. And, we'll see you next month.
Yes, thank you, everyone. Have a good day.